Today we're talking about something that happens more often than we think. Wounds from animal bites. Dog bites, cat bites, even that scratch from a pet rabbit that didn't feel like much until it got red and swollen. By the end of this video, you'll know what to do when an animal bite breaks the skin, what to look for that could mean infection, when to clean and watch versus when to act fast, and how to protect yourself, your family, and your patients. Most people think it's just a dog bite. I cleaned it, we're fine. But here's a twist. Animal bites may look small on the outside, but they can cause deep infections on the inside, especially cat bites. One patient I saw almost lost function in her hand from a bite that looked like nothing at first. So what are these wounds trying to tell us? Let's walk through it step by step. For those who don't know me, my name is Dr. Voltaire. I'm a wound care physician and family medicine doctor. And while I've spent years treating pressure injuries, ulcers, surgical complications, I've also seen what one bite can do when it's ignored. Because most of these wounds can show up in primary care, urgent care, or even at home, not in big trauma centers. If you're caring for a loved one, a patient, or even yourself, and you're not sure how serious a bite is, this video is for you. You don't need to be a surgeon to make smart decisions. Let's make bite wound care feel simple, clear, and doable. Here's what we'll cover in this video. What makes animal bites different from other wounds? Which animals cause which kinds of infections? When you need antibiotics and which ones matter most? What signs to watch for over the first few days? And near the end, I'll show you a real case where catching just one early sign saved a hand from surgery. Let's dig in. We often think bite equals broken skin. I'll wash it and cover it. But bites carry bacteria from the animal's mouth straight into our tissue. Dog mouths have crushing force. Cat mouths have tiny sharp teeth that puncture deep and then trap bacteria inside. Other animals like raccoons, rodents, or ferrets have their own risks too. Therefore, it's not just how the wound looks, it's what got in there and what's underneath. Let's take a cat bite. Small puncture, barely bleeding, but 24 hours later, the hand swells, the fingers can't move. This is Pasteurella multocida, a bacteria that's in nearly every cat's mouth. It spreads fast, especially in fingers, joints, or the face. Dog bites are more about tissue crushing and mixed bacteria, so think staph, strep, anaerobes. That's why they can cause cellulitis, abscesses, or even septic joints. Have you ever cleaned up a bite at home or in clinic and thought, I hope this doesn't get worse? Or maybe you've had a patient who swears it's nothing, but something in your gut tells you we should probably watch this more closely. Let's talk about what signs really matter. Here are the top signs that a bite wound may be infected or on its way. Redness that spreads beyond the bite site. Swelling that increases over a few hours. Pain that's out of proportion to the wound size. Pus or cloudy drainage. Warmth around the area or streaking up the limb. Fever, chills, or fatigue. And for hand or face wounds, loss of movement, tingling or numbness, pain when you touch nearby joints. These are signs that the infection is deep or spreading. If a bite happens and breaks the skin, wash immediately with soap and water for at least 2 minutes. Rinse with clean water or saline. Get any visible debris out. Don't close the wound unless you absolutely have to. Leaving it open lets drainage out. Cover it with clean, non-stick bandages. Watch it closely for 48 hours. If the bite is to the face or hands or from a stray or wild animal, get seen right away. Now this part trips people up. Not every bite needs antibiotics, but cat bites, usually yes, especially to the hand. Dog bites depends on the location, depth, and patient risk. Face, hand, foot, joint, or genitals, high risk means treat early. Patient has diabetes or is immunocompromised or elderly, also consider antibiotics. Talk to your medical provider about the best antibiotic choice for you. People often forget the basics, like tetanus vaccinations. When was their last shot? If it's been over 5 years and the wound is dirty, time for a booster. Rabies risk. Did the animal appear sick? Was it wild or unvaccinated? If yes, contact public health or follow rabies protocol ASAP. And recheck within 48 hours or sooner if symptoms worsen. Let me tell you about Mrs. C. She was gardening. A neighbor's cat nipped her finger. No big deal. She washed it, bandaged it, and went on with her day. But the next day, she couldn't bend her index finger. It was red, swollen, and tender at the joint. She sought urgent care and was given antibiotics. Luckily, we saw it before it became a flexor tendon sheath infection, but she almost needed surgery. Now I take every hand bite seriously because those tendons and joints, they're like tunnels for infection, to travel fast. Here's something I remind myself all the time. The size of the wound doesn't tell you the size of the danger. A cat puncture the size of a pinhole can be way more dangerous than a big gash from a fall. Why? Because bacteria love closed spaces. They thrive when the air can't get in and the drainage can't get out. Think of it like this. A bite is the delivery system for bacteria, and the body's immune system can't always reach where the germs went, especially if it's near tendons, joints, or the face. That's why we treat location and timing seriously. Here are my go-to questions before I decide to escalate or refer out. Is the pain getting worse after 24 hours? Is the redness spreading? Has the wound started draining cloudy fluid? Is there a loss of movement or new numbness? Is the patient feeling off, fatigued, confused, feverish? If yes to 2 or more, I'm not waiting. They need to be seen. This could be outpatient follow-up or ER if red flags are present. Animal bites in kids are especially tricky. Their faces are more likely to be bitten, especially by dogs, and their immune systems are different. So here's what I recommend. Always evaluate facial bites early. Infection risk is high and scar risk too. Don't delay tetanus checks as well. If the bite is minor and you've been cleared to manage it at home, here's a practical 3-step home protocol. Gentle cleansing twice a day with mild soap and warm water. Apply a non-stick dressing to keep it clean, and check for changes every 8 to 12 hours, so swelling, redness, warmth, and pain. Also, don't soak the wound. Don't smother it with ointments unless instructed, and don't assume improvement just because it doesn't hurt. Pain isn't the only sign of danger. Even trained clinicians sometimes miss subtle clues, mistaking an abscess for a bruise, or blaming redness on an irritation instead of early cellulitis. Also, not checking range of motion in finger or wrist injuries, and closing a wound too early without proper irrigation. These aren't just small misses, they're chances to intervene early. And if you're a caregiver or patient watching this, know that your instincts matter too. Let's not forget, rodents, squirrels, and rabbits can carry tularemia, rat bite fever. Reptiles like turtles and lizards can harbor salmonella. Bats, raccoons, and foxes are rabies risks. If the animal is wild or acting strangely, don't wait. Get public health involved and take precautions. Remember how we started? With the idea that a small animal bite might seem harmless, but isn't always. We talked about Mrs. C and her cat bite. We looked at the red flags, the real-world decisions, and the early signs that matter the most. The takeaway is that animal bite wounds aren't just skin deep. They're full of context: what bit you, where it happened, how long ago, and how the body's responding. And whether you're a parent, a provider, or just someone who wants to be prepared, you now have the tools to recognize when something needs more than just a Band-Aid. Thanks for watching. If you like this video, check out my next one on wounds from IV drug use and how to approach them with the right tools and with compassion. Stay informed and heal well.